Hello, welcome you all for the next question paper discussion. So in the last part, I have discussed you one question regarding toffee select location. Okay, so in that answer was wrong. It is not synovial membrane. Answer is muscle. Okay, just please note in that. Okay. So toffee means it is a deposition of the monosodium urate crystals. So they have given the option helix of ear, olecranon bursae, muscle and synovial membrane also they have given. But option answer is muscle. Please note that. Okay. Then another one more thing, the which vitamin is not deficient in celiac disease? They have asked one question. In the question paper, they have given vitamin C also. Okay, if vitamin C option is present in the question paper, then you have to choose vitamin C as an answer. Okay, instead of folic acid, you have to choose vitamin C. If these are the options, if you are given, then choose folic acid. Vitamin C is there, then go for answer vitamin C. Next condition is in the diabetic patient can get mainly infectious condition they have asked. So in the diabetes actually our immune system will be very low. Okay, so whenever we have an weak immune system, we will be getting candidiasis infection. That usually you should remember. Okay. In diabetes patient there will be weak immune system, so the mainly you will be getting candidiasis infection. Okay, in HIV there also we used to be getting candidiasis infection. Okay, in HIV they will be getting candidiasis infection in the oral mucosa. Okay, oral candidiasis usually associated with the HIV infected people, and then vaginal candidiasis or otherwise in the genital tract candidiasis always in associated with the diabetes mellitus. Okay, then next one condition they have asked is edema, presence of edema. Albumin is passing through the urine. Okay, albumin is passing through the urine means proteinuria. Then increased creatinine. Increased creatinine means there is a kidney failure. Then proteinuria, so which is that condition? That is diabetic nephropathy. Okay, so in diabetic nephropathy, because of the excessive this uncontrolled diabetes mellitus, it can result in the kidney damage. So whenever there is kidney damage, you will be getting increased creatinine. Okay, and because the proper this filtration of the blood is not happening, so it result in the edema. Then fatigue, nausea, then anemia will be there. Okay, anemia because of the this kidney is producing erythropoietin. Okay, the one pigment which is produced by the kidney is erythropoietin. If there is erythropoietin, then only RBC cell formation will be happen from the bone marrow. Okay, erythropoietin which is released by the kidney, this erythropoietin will go and act on the bones, then only the bone marrow will produce the RBC cells. Okay, so if there is a kidney failure, erythropoietin formation will not happen. So because of that, the patient will be suffering with a low HB count or low RBC. The patient will be getting anemia. So that's why those who are suffering with a chronic kidney disease, they will be getting anemia. Okay, and because the proper blood filtration is not happening, so it will result in the high BP, and because of the kidney damage, proteins will be started to leaking through the urine, so you will be getting frothy urine. Okay, protein if present in the urine, then it will be like frothiness. Okay, and in the same time the kidney is responsible for the formation of the active vitamin D. Okay, if active vitamin D is present, then only absorption of the calcium and phosphate will be happen from the GIT. Then only bone formation will be happening. If there is kidney failure, what happen? Vitamin D formation will not happen, and because of that, what happen? Reduced calcium and phosphate reabsorption. So what happen? The proper bone will not be forming, so bone density reduces. So you will be getting low vitamin D, so it will result in the brittle bones. So these are the symptoms of the diabetic nephropathy. Due to the diabetes mellitus, it will affect the this damage of the glomerular basement membrane will be happening, and because of that proteins will be started to leaking through the urine, and edema will be happening, and because of that fatigue, nausea, and erythropoietin will not be producing by the kidney, so it will result in the low HB, and then high blood pressure will be there, and there will be proteins are passing through the urine, proteinuria, vitamin D is not producing, so it will result in the brittle bones. So these are the symptoms of the diabetic nephropathy. Next question was a woman, she is suffering with a irregular period since 1 year, weight loss is there, and she is one of the member in school gymnastic. Okay, so option was PCOD, prolactinoma, and female athlete triad. Okay, so the answer will be female athlete triad, because female athlete triad means those who are excessively doing some of the exercises like gymnastic, athletics, all those things. Okay, excessive exercise, so because of that what happened, they will not eating properly the food intake. Okay, so because of that excessive exercise and unhealthy eating behavior. Okay, that is the main two things, excessive exercise and unhealthy eating behavior. Because of that there will be menstrual irregularity, especially amenorrhea they will be getting. Okay, and because of the excessive exercise and you are not eating properly food, it result in the weight loss, and frequently they will be getting injuries also. After the injury, the recovery also is getting very slow. Okay, and they will be having some mood disturbance also you will be getting. Okay, so these are the symptoms of the female athletic triad. Another name of female athlete triad is relative energy deficiency in sport. Relative energy deficiency in sport, REDS. Relative energy deficiency in sport, that is the another name of female athletic triad. Next question was bronchiectasis sicca, seen in which condition? So first of all we have to know bronchiectasis. Bronchiectasis means dilatation of the bronchi. Okay, dilatation of the bronchi is called as bronchiectasis. Usually there will be too much of sputum will be present in the bronchiectasis condition. Okay, so but bronchiectasis sicca means there is a dilatation of the bronchus, but there will be absence of sputum, that is called as bronchiectasis sicca. Okay, bronchiectasis sicca means dilatation of the bronchus has happened, but there is absence of the sputum, absence of copious amount of sputum. That is the main important characteristic feature. Okay, that is called as bronchiectasis sicca or dry bronchiectasis. Okay, so this is usually seen in the condition of tuberculosis. Those who are suffering with the tuberculosis, they used to get this bronchiectasis sicca, and it is usually happening in the upper lobe area. So the main clinical presentation is dry cough associated with the hemoptysis. Hemoptysis means blood mixed vomiting. Okay, so these are the symptoms of the bronchiectasis sicca usually seen in the tuberculosis condition. Next one is cough, night sweat, weight loss in X-ray, hilar enlargement. So seen in which condition? Answer is sarcoidosis. So sarcoidosis means it is a condition where the immune system will be overreacting. Okay, immune system overreacting, and because of the overreaction there will be multiple nodules are forming, that is called as granuloma. Okay, so the overreaction of the immune system, and because of that overreaction the cells are getting clumped together and they are forming a structure called granuloma, and wherever it is forming, so that particular area you will be getting the symptoms. Okay, usually it is locating in the lungs. Other than lungs, you can see in the lymph node. Okay, there you can get granuloma formation. In skin you can get, in eyes also you can get the granuloma formation. So which organ this granuloma is forming, according to that you will be getting the symptoms. Okay, so if the granuloma is forming in the lungs area, then the symptoms you will be getting is cough, shortness of breath, chest pain or discomfort will be there, labored breathing. Okay, so there is a granuloma forming in the lungs that is called as pulmonary sarcoidosis. If it is not treated properly, this granuloma will turn into fibrosis and it leads to the lung scarring. Okay, so these are the complication of the pulmonary sarcoidosis. So usually there is a granuloma is found. Okay, so if it is happening in the lungs, then it is called pulmonary sarcoidosis. It can happen in the lymph node also. It can happen in the skin. It can happen in the eyes also. You can get this granuloma. Okay, so granuloma means it is a overreaction of the immune system. Okay, so if you just examine that granuloma, you can see there will be presence of the WBC cells will be there, dense tissues will be there. Okay, this type of things are making together granuloma. Along with the pulmonary symptoms, you can get joint pain. Okay, you can see additional symptoms are the tiredness, weight reduction, night sweat, frailty, fever, joint stiffness, arthralgia, enlarged lymph node, especially peripheral lymphadenopathy. Okay, so these are the main important symptoms of the sarcoidosis. Okay, so investigations are chest X-ray, CT scan, pulmonary function test, blood test, bronchoalveolar lavage, lung biopsy. So these are the investigations to be done for the identifying pulmonary sarcoidosis. So in the X-ray, how the sarcoidosis is happening. So there is 5 stages are there. Okay, so in the starting stage, stage 0 means normal chest X-ray. Stage 1, okay, so when the granuloma is started to forming in the lungs, then you will be getting hilar enlargement. Okay, hilar or mediastinal nodal enlargement. So hilar means it is a part of the lungs. Okay, hilar means it is a part where the blood vessels and nerves are getting attached to an organ. Area where the nerves and blood vessels are attached to an organ, that portion is called as hilar or hilum. Okay, area where the nerves and blood vessels are attaching to the organ, so that portion is called as hilar or hilum. So that portion will be started to enlarging. So that is the first symptom you will be getting in the X-ray in sarcoidosis, hilar enlargement or mediastinal enlargement. Then in the stage 2, this hilar enlargement plus parenchymal disease you can see. Parenchymal disease means in the lung parenchyma the disease will be started to aggravating. Okay, in the stage 3 you will be getting only parenchymal stage, and in the stage 4 you will be getting the pulmonary fibrosis. So these are the 5 stages of the sarcoidosis. Okay, so the 0 normal chest X-ray. In the stage 1 hilar or mediastinal enlargement. In stage 2 nodal enlargement plus parenchymal disease will be there. In stage 3 parenchymal disease. In the stage 4 end stage lung disorder, that is pulmonary fibrosis. So these are the 5 stages of the chest X-ray you can see in sarcoidosis. So that hilar enlargement, it is known as Garland triad or otherwise known as 1, 2, 3 sign. Okay, you can see in this picture they have marked the arrow red color, that is 1, 2, 3. Okay, so that is 1, 2, 3 sign or otherwise known as Pawn-Broca sign. Okay, it is a lymph node enlargement happening in the chest X-ray. So what are the nodes are enlarging? Right paratracheal node, right hilar node and left hilar node. So these 3 areas are getting enlargement. So this is the main typical X-ray feature you can see in the sarcoidosis. So this is known as Garland triad or otherwise known as 1, 2, 3 sign or otherwise known as Pawn-Broca sign. Okay, right paratracheal node, right hilar node, left hilar node. So these are the nodes are getting enlarged in the sarcoidosis. Next one, hypertension. So in the hypertension, what are the features you will be getting? Increased cardiac output, decreased cardiac output, increased peripheral vascular resistance. So in hypertension there will be severe blood flow will be there. So you will be getting increased cardiac output. So those who are having hypertension, they will be getting increased cardiac output. And then hypertension reflex is also known as carotid baroreceptor reflex. So they have asked the receptor name. Hypertension reflex is carotid baroreceptor reflex. Next, they have asked a question regarding hypertension in pregnancy. Okay, after conceiving, if you are getting hypertension, that is usually happens 20th week of pregnancy. That is an important point. After 20th week only, hypertension will be generated in pregnancy stage. Okay, it is a condition that pregnant women appear at least 2 of the 3 signs including hypertension, proteinuria and edema after 20th week of pregnancy. After 20th week of pregnancy, the patient is getting hypertension, that is called as pregnancy induced hypertension. Okay, first it will be starting with the increased blood pressure, and if that increased blood pressure, if we are not controlling with the diet or with the medicines, it is not getting controlled, then it leads to the proteinuria. Okay, so that is called as preeclampsia stage. Okay, if hypertension is not controlled properly, so you will be getting proteinuria and edema in the lower limb. So that condition is called as preeclampsia. Okay, and if preeclampsia, if it is not treated properly, or that time itself if you are not giving medicines, then what happen? There will be end organ damage. Because of the severe blood pressure, the organs will be started to collapsing. So there will be increased BP. So end organ damage means you will be getting kidney failure. Okay, liver function disorder also you will be getting, especially in liver you will be getting HELP syndrome. Okay, HELP syndrome. So due to the presence of the NK cells, oxidative stress, so due to some of the genetical factors, what happens in placenta, the decidua, you can see decidua, myometrium. Okay, so these all should be, will not be in a correct place, which means there is an abnormal vascularization will be happening in the placenta. Okay, because of the presence of the NK cells, oxidative stress, some of the genetical factors, there will be abnormal uterine vascular remodeling will be happening. Okay, you can see in the normal pregnancy there is a flask shaped structure is coming for the placenta, but in the here, because of this reason, because of this causative factors, the placenta is not developing very widely. Okay, because of that there will be reduced placental perfusion. The blood will not be going into the fetus. So there will be blood circulation reduces. So it results in the IUGR, pedal edema, then HELP syndrome in the liver, and then proteinuria, hypertension. So these are the clinical features of the pregnancy induced hypertension. So HELP syndrome means H stands for hemolysis. Okay, very early RBC destruction is happening. Increased elevated liver enzymes. Okay, elevated liver enzymes, EL, and the last LP is low platelet count. This is called as HELP syndrome. Hemolysis, elevated liver enzymes, low platelet count. So this is called as HELP syndrome. This is because this is getting because of the liver failure, because of the hypertension. So okay, so pregnancy induced hypertension is happening in after the 20th week of gestation because of the placental hypoperfusion. Okay, blood supply, because of the placental abnormality, blood supply to the fetus is reducing, so it result in the hypertension, and because of that you will be getting proteinuria, okay, edema. Okay, so these are the first symptoms, and if it is not treating properly, then it leads to the kidney failure and then HELP syndrome. Okay, and if this is called as preeclampsia. Okay, preeclampsia means hypertension, proteinuria, edema. Okay, if preeclampsia is also not treating properly, it leads to the next stage, that is called as eclampsia. Okay, eclampsia means preeclampsia plus seizure. Okay, which means hypertension, proteinuria, edema, plus if the patient is getting seizure, then that condition is called eclampsia. So this is all about the pregnancy induced hypertension. After 20th week of pregnancy it is getting. Okay, and main important symptom is increased blood pressure will be there. If it is not treating properly, it leads to the condition called preeclampsia, and because of the preeclampsia, the patient then baby will be getting IUGR, intrauterine growth retardation. Okay, then brain damage, they can get HELP syndrome, they will be getting kidney failure. Okay, so these are the complications of the pregnancy induced hypertension. Next one, dry eye syndrome. Dry eye syndrome means where the tear is not producing properly, or there is adequate moisture of the eye is not happening properly. That is called as dry eyes, or otherwise known as keratoconjunctivitis sicca. Keratoconjunctivitis sicca. The tear film is not producing properly, so because of that moisture content is not there in the eye. Okay, so because of that, what are the symptoms you will be getting? There is a stinging or burning sensation, redness of the eye, episodes of blurred vision, there is a gritty sensation in the eye, excessive tearing. These are the symptoms of the dry eye. Reasons for getting dry eye syndrome is Sjogren syndrome. Okay, due to Sjogren syndrome, you can get keratoconjunctivitis sicca, then diabetes, then thyroid disorder, then blepharitis. Okay, these are the main reasons for getting keratoconjunctivitis sicca: Sjogren syndrome, diabetes, thyroid eye disorder, blepharitis. Sjogren syndrome means it is an autoimmune condition. Okay, it is an autoimmune condition. So here what is happening, there will be damage to the glands, and because of that there will be moisture content will be reducing. Okay, especially they are damaging the glands of the eye region and mouth region. Sjogren syndrome, autoimmune disorder, so they will be damaging the glands, and because of that there will be less moisture content. Okay, so mainly they are damaging eye region and mouth area. Okay, so you will be getting, there is a tear function reduces in the mouth, salivary gland function reduces. Okay, so these are the main important symptoms of the, or main things will be happening in the Sjogren syndrome. Okay, dry mouth will be there, dry eyes will be there, dryness of the skin will be there, vaginal dryness. Okay, and dryness of the nose, and because of that you will be getting frequent nose bleeding, dryness of the throat. Okay, so these are the main things, main symptoms of the Sjogren syndrome. Okay, one of the reason for getting dry eye is Sjogren syndrome. Sjogren syndrome means it is an autoimmune disorder affecting the gland, and because of that moisture content reduces. So mainly it is affecting the eye and mouth area. Rest of the other organs are also affecting. So because of that you will be getting dry eyes, dry mouth, dry skin, vaginal dryness, dryness of the nose, and because of that you will be getting frequent nose bleeding. Then dry throat also will be there. These are the symptoms of the Sjogren syndrome. Okay, so dry eye, or otherwise known as keratoconjunctivitis sicca. So these are the main things which is asked in the MOH examination.